Thursday morning press conference where we talk about COVID-19 with a focus on the African continent. And as usual, we are joined by the Director of the Africa Centers for Disease Control and Prevention, Dr. John Nkengasong. We are going to give him some time to give us a brief before we go into the Q&A session. But before we do that, let me just make some house announcements. If you have any questions, kindly write your name and the institution that you represent to the WhatsApp number +251 945 502 310. I'll take that again, +251 945 502 310. Alternatively, you could do that in the chat column of the blue jeans, and then you'll be given a chance to speak. But that's only when we get to the Q&A session. And I would also like to inform you that our session today will be 45 minutes long. It's time now for me to hand over to Dr. John.
Thank you, Wynne, and good morning, colleagues. As always, it's a pleasure for me to have this conversation and dialogue with the media every Thursday. And my apology that last Thursday I could not be here with you because I was pulled into briefing the Peace and Security Council of the African Union. And let me again continue to appreciate your very strong support as we fight this pandemic, which is we need to use a holistic approach in fighting it, and the media is an integral part of this strategy to help us clarify issues, inform the general community, and make the right corrections if need be. So I would like to first of all acknowledge the efforts of all the healthcare workers and volunteers providing services across the continent, at times under very, very challenging conditions in Africa, very difficult working conditions across the globe as a whole. I just also want to assure member states of the continued support of the African Union through the Africa Centers for Disease Control and Prevention to ensure that every country is carried along in a collective effort to respond to the COVID-19 through the Africa Joint Continental Strategy for COVID-19 that we developed, and this strategy, as you all are aware, has been endorsed by the Bureau of the Head of States, and that's our guiding document so far. I also like to mention at this point that it's very important that we recognize that the battles will be fought locally, that is within each country, member state, but the overall victory has to be continental, because COVID infection in any African country represents a COVID infection in all African countries. I think we have to, as a continent of 55 member states, we have to express that continental solidarity very strongly. So let me transition to the epidemiological situation. As of 9 a.m. East African time today, the world had reported a total of 3.6 million people infected with COVID-19. And this is coming from 215 countries. And sadly, over 250,000 people have unfortunately died from this terrible disease. On the continent of Africa, where 53 countries reported 51,698 cases, and 2,012 cases, people have died from this infection, representing a case fatality rate of 3.9%. So we've now crossed 50,000 benchmark. If you all recall, when we started having this dialogue, our numbers were around 500 and 600, and today we are counting 50,000. So we are still on the upward trend. The good news is that of the 50-something thousand infected, 17,590 people have recovered. I think we need to celebrate every little victory in this. I think we are extremely thankful and for those that have recovered. Between 30th of April and 6 May, 14,757 new cases had been reported compared to 10,500 cases that were reported between the previous week, the week of 22nd to 29th of April. This is about 1.5 times more cases reported this week. So we've seen almost 1.5 increase, more cases this week than the previous week, with an average of about 2,100 new cases reported per day. Again, 2,108 cases reported per day. The number of deaths include several healthcare workers, and that's why it's so sad. We have to protect people that protect us. And the healthcare workers are frontline, and it's unfortunate that we are beginning to see this increasing trend amongst healthcare workers on our continent. Let me now just walk you through the regional trends. As you all will recall, there are 5 regions, geographic regions of the continent, and I'll try to give you some update across those 5 regions. This week, the Western Africa region accounted for 36%, or 5,243 of the new cases, followed by North Africa region, with 30%. Representing 4,492. Then Southern Africa region with 17%, representing 2,557, and followed by Central Africa region with 9%, which represents 1,280, and East Africa 8% with 1,185. The 5 countries with the highest cumulative number of cases include South Africa with 7,800 cases, or 15%, followed by Egypt, 7,500, Morocco, 5,400, Algeria, 5,000, Nigeria, 3,100. These 5 countries account for 56% of all cases reported on the continent of Africa. Countries reporting the highest number of cases per 100,000 population include Djibouti, Mauritius, Equatorial Guinea, Cape Verde, and Gabon are reporting the most cases per 100,000 population. 8 countries are reporting case fatality rates comparable to or higher than the global case fatality rate of 6.7%. We also note with happiness that Lesotho and Sahrawi Democratic Republic remain the only 2 African countries with no cases. And on to date, there are 25 registered clinical trials on COVID-19 in Africa. I underline the word registered trials. For more information, we would like to invite you to continue to update yourself from our website, which you all know, which is africacdc.org, one word, and you'll find the COVID page there. Let me now conclude by giving you an update on what Africa CDC is doing. We have developed a strategy for scaling up COVID-19 testing as part of what we are calling the Partnership to Accelerate COVID Testing, in abbreviation PAC, which I highlighted the other week, PACT. And PAC is underpinned by 4 things. It is underpinned by track. We need to track people that are possibly at risk of infection. When we track them, we test them. And if we test them, we have to look for their contacts. We isolate them and quarantine them and look for their contacts, and what we call contact tracing. And then those who are actually infected and are sick, we care for them. That is the treatment component of it. So it's a 4T strategy that the chairperson of the African Union Commission, His Excellency Musa Faki Mohammed, launched about 3 weeks ago, that we are driving, and will continue to be the guiding, the cornerstone for our strategy. We have to keep it simple and go back to basics, the basics of public health response, which is what we call the standard shoe leather epidemiology, and put a lot of foot soldiers in the field. That's why we are advocating as part of the pact to have 1 million Africans deployed across the continent to run around and support the pact strategy, especially the track. We need to find the people, bring them into, test them, and isolate them. So we're calling on that partnership for the community workers, at least 1 million to be deployed across the continent. Secondly, we've updated guidance to member states on physical distancing. And this is an evolving, the more we learn on this outbreak or pandemic, the more we adjust our strategies and adjust our guidance. The Africa CDC has also engaged a group of modeling experts with various backgrounds to support the efforts to estimate the impact of the pandemic in Africa. And the modeling being used include country-specific reports on the peak size and timing, the healthcare demand and intervention impact, the case, death and hospitalization simulation that can be manipulated by countries, and intervention, which means each country can actually use that and customize it to its own needs, and then estimating the effect of lockdown and post-lockdown interventions. We're also looking at estimating cases and changes in the effective reproductive numbers and doubling time for several member states there. And then generating evidence for shading, self-isolation, physical distancing in 3 different age groups there, and the interaction with data visualization for countries there. Africa CDC continues to facilitate knowledge sharing and training for healthcare workers in Africa through online platforms. In the past week, we facilitated webinars on analysis and interpretation of surveillance data to inform policy decisions for 146 experts from 26 member states. We've trained 32 experts on pathogen genomic sequencing, that is tracking the genetic material of the virus and using that to understand how they are spreading in different communities. Webinars on fast results turnaround for COVID testing for 600 participants in partnership with the Clinton Health Access Initiative and the African Society for Laboratory Medicine, ASLM. We continue to hold, we held the 8th weekly webinar for clinical community of practice for 306 participants, and organized webinar on data use for action, analysis, interpretation of surveillance data to inform policy decisions for more than 100 participants from 30 member states. And then lastly, conducted a webinar on leveraging severe acute respiratory illness and influenza-like illness surveillance framework for COVID-19 pandemic response and beyond, sharing the South Africa experience and lessons learned. Just lastly, I just need to update you on the African Union COVID Fund, Response Fund, which is fully active now. As I speak, the second board meeting will be held today, of course, through video conferencing. And we continue to ask that both the public, private, and individuals continue to support that fund. And then we are in discussions with the government of Madagascar with respect to the HEBA supplement, which you've all heard in the media, and to understand what is actually going on and see where we can develop an appropriate partnership there. Let me just emphasize that we should all be wearing masks, not clean surgical masks, but locally made masks, so that we can mitigate and continue to implement measures that would diminish transmission in our communities there. And I will end here, and without much ado, turn it back to Winnie for the interactive session. Thank you.
All right, thank you very much, John. I'm looking at our timer, and we have just over 30 minutes, and already we have quite a number of questions. So we'll try and go through those very quickly. The first one is coming from Mohammed Abu, and he's chief correspondent of the Africa Development magazine based in Accra in Ghana. He says the WHO has expressed its concerns about the safety, efficacy test and clinical trial duration of the Madagascar herbal remedy. What is Africa CDC's take on such concerns? Then he has a second question. Does the Africa CDC have any collaborative relations with the developers of the COVID organics remedy? That's from Mohammed Abu.
So I just take that question?
Yes, please.
So thank you, Mohammed, for that question. I know it's on everybody's mind. First of all, to say that the Africa CDC, as a specialized technical agency of the African Union, has issued a statement, and you can find that statement on our website, which essentially does three things. One is that it recognizes that the fact that the head of state of Madagascar gave a presentation of that remedy during a meeting, a video conference meeting with the Bureau of the Head of State, and that was it's simply information sharing. Second is that after that presentation, we, the African Union Commission, under the leadership of Excellency Commissioner Amira, and I met with the ambassador or the representative of the Embassy of Madagascar to ask for an opportunity to understand more what the remedy is about, and thirdly, to invite the scientists from Madagascar who are driving this process to join our technical working group, which is the African Task Force for Coronavirus Preparedness and Response, so that we can better understand what they've done, what the remedy is about, and they can share data with us. We are looking principally at two things. We are looking at safety data, and that they've generated. Secondly, we are looking at efficacy data. What exactly did they do? We know that Madagascar has very competent researchers, very competent public health experts, and we are sure that and convinced that in the coming days they will join, they will take our offer, and we'll sit down and look very carefully into what was done and what the results and outcome was, and then we'll be able to understand and make the appropriate recommendation. I'll just end there by saying that regardless of what the challenge we have at hand, there are always two things that we must remember. First is that any medication, remedy, that anyone lays a claim on must have gone through an independent clinical trials or evaluation. Second is that that evaluation has to show that it is safe, and secondly, that is efficacious. Those are three things that we are looking at, and that it was conducted ethically. So I think those are standards that are known all over, and WHO has published that over the years, and all respected organizations adhere to those standards.
Thank you very much. I think that also answers a question coming from Sophie Mkwena, where she says, what's your reaction to the reports that Madagascar is producing medicine that can treat COVID-19? I think that question has been answered. But keeping up with the theme of the Madagascan herbal remedy, we have a question from Catherine Soy, and she's a correspondent with Al Jazeera. She says Tanzania's president has put the blame on testing kits in his country, saying that they are faulty. His top scientists have been fired, and the government has been very secretive on their numbers and what's being done to contain the outbreak in the country. How detrimental is all of this to the fight against COVID-19 in Tanzania and many other parts of the regions? So this is one question from Catherine. She goes on to say, The Madagascan president recently endorsed a herbal drink which he says cures coronavirus. Some African countries, including Tanzania, have said that they will use this treatment. Could the push for such unapproved herbal remedies cause a setback for the continent, or is this an opportunity for bodies like Africa CDC to explore herbal medicine that has historically been used in Africa? Those are two questions from Catherine.
So, Catherine, thank you so much for those two questions. Let me start with the Tanzania piece and address that very broadly, that the test that Tanzania and all African countries are using are the tests that we have validated, and we know that they are performing very well. And we were very instrumental in training, providing training to nearly all countries and providing them with test kits. We've also, in the last couple of weeks and months, distributed tests from the Jagma Foundation that have been validated and proven to be very, very reliable. So I would just say that we should remember what our joint continental strategy, which was endorsed by the Bureau of the Head of State, speaks to. It speaks to a couple of things. It speaks to cooperation, coordination, collaboration, and communication. So the cooperation piece is very important because no country in Africa is an island. And as I stated earlier in my introductory remarks, COVID will not be eliminated in any country if we have it anywhere on the continent there. So COVID in Tanzania is COVID in Tunisia, is COVID in South Africa, everywhere. So we really have to coordinate our efforts as much as possible and cooperate with the Africa CDC and with WHO so that we exercise coherency and build trust with the community. And my last remarks on that is that we have to really ensure that the victory against COVID-19 is led by the community, is owned by the community, and we have community champions. That is the only way you build trust with the community, so that we send a coherent message with the community. It starts in the community and ends in the community. So by building a coherent message in the community from the top leadership of the continent, will help ease the struggle. We are in for a very long fight. I mean, let me be very clear with everyone. We are just at the start of our journey into this. It's a war that will see many battles that will be won and many battles that will be challenging. But overall, it's a war that we have to win, and we have to win with cooperation with the political leadership, cooperation with the public health experts, cooperation with the community, and cooperation with the scientists. So I think that is very important. Now, with respect to the approved herbal remedy, it is a fact that local remedy on the continent has proven over the years to be extremely valuable as part of our overall healthcare system. We should not neglect that. And with Africa CDC, as your specialized technical agency, it stands by to work with anyone who has any product that can bring a solution to this war that I just described. The African Union also has a regulatory bodies with NEPAD that we can work together as part of the task force that we established called the African Task Force for Coronavirus Preparedness and Response to test and tease out some of these remedies there. We should not discount anything at this point. We should know that the solutions may come completely from unexpected quarters, but all we ask is that it should be a standard way of doing things that follow a standard protocol that is known, in the scientific community, and that scientists and public health experts should be leading these efforts in the country, and no one should be in the haste to declare and make any announcement on any remedy or herbal product that has not been tested rigorously. It's very important that the two key things are protected, which is safety and efficacy of those remedies.
Thank you. We have another follow-up question on Tanzania. Let me just exhaust those ones. This one is from Sophie Mkwena. And she says, many people have questioned the measures adopted by Tanzania in the fight against COVID-19. Have you engaged Tanzania on the concerns raised?
So Tanzania, as a member state, we enjoys the same level of support that we've provided. The country, of course, countries are very are independent. They are sovereign states, and they can do they can support the response the best they can. It is the responsibility of every member state to ensure the safety and health security of its citizens. The Africa CDC and the African Union Commission can only support countries to achieve their targets and desire. And we continue to do this through providing guidance, providing guidelines, advocating and providing technical support. I think that's how we can continue to engage with all member states, including Tanzania. And we will continue to intensify our efforts with Tanzania to understand the trends in the country, where they are heading to, where they need help, and technical assistance we are always on standby to provide such assistance.
Thank you, John. We now go on to Maren Saibo, and she's an independent Norwegian journalist specializing in African affairs and currently doing an article on Africa's response to COVID-19 for the Norwegian Daily. Maren has sent us 5 questions. I'll take the first 2, and then we'll go on to other questions and come back. The first one is, what has been done so far to prepare the continent for COVID-19 infections? And what is the importance of a continental approach to this pandemic? The second question is, what is the role of the Africa CDC? Is it mainly an advisory entity, or does it take a more operational role if needed?
So, very good question from our colleague from Norway. With respect to what the continent has done so far, it is perhaps the continent that sensed that the threat of COVID was so serious that when the first case appeared on the continent in Egypt on February 14, the chairperson of the African Union Commission convened a meeting of an emergency meeting of all ministers of health here in Addis Ababa to discuss the threat. At that time, we could call it a threat because only 2 or so cases were reported in Egypt. That meeting was fundamental because it brought the political awareness and leadership to bear, and the outcome of that meeting was twofold: that the joint continental strategy was elaborated and endorsed by the ministers themselves, sitting in that meeting. And it was underpinned by a couple of things which I've highlighted before, that there's need to cooperate, to collaborate, to coordinate, and to communicate. I think that, and this has been the underpinning of the strategy, the joint strategy going forward. I think the ministers, under the leadership of the chairperson of the African Union, recognized very early that we cannot win the fight against COVID individually, that it has to be a collective effort and it has to be coordinated using all the assets that exist on the continent. So there's value in that. And since then, the task force has been working on a weekly basis, and the task force has a technical advisory committee to that ensures that the technical issues are discussed and agreed on as a strategy to implement. The Africa CDC plays both the advisory role, the policy guidance role, and operational role. We have been instrumental in 5 broad categories of activities to prepare the continent. 1, in the area of diagnostics. Again, it is known that we were that body that very quickly ramped up diagnostics from almost no country in Africa to test for the COVID-19 in January to about 43 countries equipped to testing the virus by the first week of March. We also have provided extensive training to more than 40 countries on infection prevention and control. The third area has been the area of surveillance and enhanced airport. We brought airlines, airports, and member states to Kenya back to back in February and trained them on surveillance and enhanced airport control. We've also been very active in the area of case management, where we've trained over 4,000 clinicians across the continent on case management, and lastly, in risk communication. We now have another area of interest, which is the research standards and regulatory working group that brings together member states, the WHO, and other universities together to look into the research issues that we should be focusing on to respond to the outbreak. So all of that is to say that we are not just an advisory group, but we are truly a technical, specialized agency that is working side by side the World Health Organization and others to respond to the COVID-19 in the most appropriate manner.
Thanks a lot, John. Now we move on to Kara Anna from AP. And Kara says, has the US started delivering testing kits, ventilators, and other medical supplies to African countries? And if so, which ones? This is one. The second one, also, how can you ensure that African nations are not at the end of the line for access to a vaccine? Which non-African countries have already signed advance purchase agreements with vaccine makers? That's Kara N from AP.
So we all know that we're challenged as a planet. We are seriously challenged that the COVID-19 has attacked countries almost at the same time, and the US has a massive pandemic going on. But it's important to note that what the US investment in Africa has been. I mean, the US investment in health, just under PEPFAR alone, has mounted to over 80 billion over the last couple of years. The reason I say that is that through that investment, you have extensive infrastructure in place, both for laboratories and workforce development and other areas that can be leveraged on very quickly to scale up the COVID response. We should never lose sight of this. This is very, very important. That I keep reminding all of us that you don't build your health systems when you need them. You build your health systems before you need them. I think that is very important. That is what that kind of a PEPFAR support has provided the continent. So with respect to the test, we know that the globe as a whole is very challenged with the test, and the US is challenged with the test. The European countries are challenged with the test, but the infrastructure to roll out the test exists, which has been supported extensively by the United States government. The second question with respect to vaccines being at the end, that is a very important consideration. It's important to note that we are faced with a virus that is affecting about 7-point-something billion people in the world. So about 7-point-something billion people will be in need of a vaccine. So this is not one of those diseases that are localized. And so because of that, we need to have a comprehensive dialogue now with respect to access and equity to vaccines. I mean, we can't delay that conversation. A continent of 1.3 billion people must have access to vaccines when the vaccines are available and in a timely fashion. So I think we have those discussions going on. I'm actually on the board of the CEPI. CEPI is the Coalition for Epidemic Preparedness Innovation, and we have a board meeting just in a few hours coming up, and this topic will be discussed extensively on that. I will be tabling that for discussion. So it's a very a timely question. We want to be considered as all nations in the world and not be considered when everybody else have had their vaccines.
I have the next question, which is coming from Sonia Beard. And Sonia is with the African Exponent. She says, many African Americans are dying at disproportionate rates. Are you noticing comparatively high death rates in sub-Saharan nations?
As I indicated earlier today, Sonia, we currently have, out of 50,000 cases reported, we currently have about 2,000 deaths. If we distribute that among the 55 member states, it's unfortunate that we even have any one death on the continent. However, if you distribute that, it's not overwhelming, as we are seeing in the United States, Europe, and what we saw in China. Having said that, I just want to be very, to continue to issue a cautionary note here that we are not testing enough. As of yesterday, the continent as a whole had tested about 850,000 people on a continent of 1.3 billion. So the importance of this is that if we test, we'll find, as I've said, and if we find the cases, that is where we track them, and we know where actually if they are surviving and they are dying. So I think it's very important to note that. But we are not seeing a large number of deaths as in the United States and Europe.
Thank you. Cristina Ferreira of the Portuguese news agency Lusa says Equatorial Guinea, Sao Tome and Principe, and Guinea-Bissau recorded significant increases in cases this week, although in the overall context of the continent, they do not have many cases. These countries, including Cape Verde, are among countries with the most cases per 100,000 people. How do you view this evolution? And then she has another question asking you to comment on the testing across the African continent. Her third question, I think you've already dealt with, and that referred to the Madagascar herbal remedy. So we have two from Cristina Ferreira.
So again, those are extremely important questions for the simple reason that what I've been reiterating, that please, as a continent, we cannot be complacent and say that we have few cases. This is a very dangerous virus. It's a treacherous virus, and it has the ability to spread rapidly, and especially when given the right conditions to spread. So it's not the low case number or the caseload should not deceive us. I think we all saw what happened in the United States. By the first week of March, they had very few cases and almost no death. And by the mid-April, they had reported over so many deaths. So I think we should be very, very careful that we do not lift our eye up the ball. The enemy is the virus. And any country can very quickly observe a rapid turnaround where you have more cases than is expected. So we continue to intensify our public health measures, which is track, you test, you trace, and you treat people. Those measures must be in place, and all governments should do everything to scale that up. And that leads me to the second question of the testing. Again, testing is the cornerstone of this fight. I mean, without a test, we will be fighting blindly. And we have to intensify that. And the framework that the African Union chairperson had offered us, which is PAC, the Partnership to Accelerate COVID Testing, is the most appropriate strategy that we have to push to avoid that the situation gets out of hand. And we as an Africa CDC are pushing diagnostics. We set ourselves a target of rolling out more 1 million tests within 4 weeks. I think we are really on course in meeting that. We've distributed over 200,000 from a depot in Senegal. We have 500,000 tests that came in from China with the Jack Ma Foundation, which will be distributed this week. An additional 1 million tests have been ordered from Germany. So I think we're doing all we can to push the diagnostics into the country as much as possible so that we should be ahead of the pandemic, not behind the pandemic in terms of testing.
Thank you very much. Sam Eferaro from Africa Health Times in Nigeria. You must have heard of reports of how Nigerians now troop to banks and marketplaces in their thousands since the lockdown was relaxed, without any form of physical distancing. What do you think of this, and what would be your advice to the government?
My advice to the government and to Nigerians as a whole is that let's take this virus seriously. We are not yet, we should be preparing for a long journey. And unlocking the system doesn't mean we should relax the public health measures of physical distancing while we do activities. Wearing masks, especially locally made masks, this is an appeal for people that go into congested areas in the markets, in banks, to make sure you wear locally produced masks. And I think Nigeria is very industrious and full of talented people. They can produce these local masks that will help decrease the transmission as much as possible. I think it is a collective responsibility. The government of Nigeria cannot do this alone. It has to earn the cooperation of the citizens and the community, such that everybody takes personal responsibility and personal accountability in the fight against COVID-19. Again, it is a very dangerous virus. It spreads very, very quickly and can be overwhelming once we lose control of this virus.
Ibtizem Ginford of ABC News. Is there a fear that the reallocation of resources to fight COVID-19 will put at risk the prevention and treatment efforts against other diseases that still kill in Africa, and those are including malaria and measles?
Absolutely. I think it is clear that we have to be very deliberate in approaching the fight against COVID, and take a holistic approach, and know that it's not because COVID has been with us for 4 to 5 months that the things that have been killing us extensively on the continent have disappeared. That is the TB, the malaria and HIV, the immunization programs, the maternal child health programs, and the non-communicable disease programs. We have to look at this as a whole. In West Africa, we should always remember that so many people died because of Ebola, not from Ebola. So again, and that's why when we designed our strategy, the continental strategy, it had 3 pillars. One was to limit transmission. The second was to limit deaths. And the last was to limit harm. And harm here was captured broadly to include the harm that the COVID may have on HIV, TB, and malaria programs and other programs of the continent. The harm to the human rights issues, harm to the economy. I think that's what that pillar is about. So we are very deliberate in this. And in the next, the coming week or so, we shall be putting out guidance on what countries should be doing or not doing to protect the HIV, TB, and malaria programs. Recalling that these programs, these infections account for almost for more than 1 million deaths on the continent every year.
Let me come to Sophie Mkwena again, and Sophie is with SABC. She's the foreign desk editor. Do we have enough protective clothes for health workers in Africa?
We are working very hard in a coordinated manner to make sure that what I call the commodities required for the response spectrum are met. The response spectrum includes the prevention arm, the treatment arm, and the harm arm. So I think we are at a better place than where we were several months ago, because of we're trying to unlock the supply chain system there, for personal protection. But as I said earlier, we have to be very deliberate, and this is a message to all member states. We have to be very deliberate in protecting our healthcare workers, because these are the people that protect us. These are the front line. When you talk of the harm to the HIV, TB, and malaria programs, if these people are infected and they die, that becomes a very, very complicated situation to handle other infections. So we are working very hard to ensure that the supply chain management for these commodities.
Ian Panel of ABC News. There are dire warnings about an exponential increase in cases in Somalia. What is your estimate of the situation there? Why is it so bad? And Somalia's ability to handle a major outbreak?
We all know Somalia is going through, continues to be a country that is challenged with the instability there, and instability and fighting a disease do not go hand in hand. I think that much we should recognize, that it becomes a fertile environment for the virus to spread and spread rapidly. We should always remember that. Just to use the analogy in DRC, we have been fighting Ebola in North Kivu for the last 2 years, and the reason is because of the insecurity that exists in the region. So once you have insecurity in a region, you expect to have challenges in fighting. It becomes tougher to fight the virus in there. So we are very concerned with the situation in Somalia, and we cannot resist getting concerned. But we are here as Africa CDC to lend all support to the government of Somalia to fight this outbreak in the most appropriate way. WHO is also in a situation to support, and many partners. So we just need to coordinate our efforts more with the government of Somalia.
We have a question coming in from Michael Omare from Tunacheki. And Michael says, how long do you recommend governments on the continent to keep their lockdown and curfew measures? So
we are actually in the issue of issuing guidance on how to ease up lockdown. And hopefully by next week, those guidelines should be out. But once we issue that, I think it's really up to the countries to take those guidelines and then customize it in their context, the local context. It's very important to do this because, you cannot issue a blanket recommendation to all countries. They should be looking at a stepwise approach in unlocking the system so that people can continue to, of course, ensure that the livelihoods are protected and the lives are protected. So it's always a balance between saving lives and livelihood of the continent.
Thank you. Della Russell of the Daily Graphic in Ghana says many African countries that implemented lockdown restriction programs to hold the spread of COVID-19 have had to back down on the arrangements due to the economic impact it was having on vulnerable households. In Ghana, we have seen the restrictions being lifted. However, cases have seen exponential rise in the last few days, pushing the numbers to a little above 3,000. What will be the Africa CDC's recommendations for economies such as Ghana and others that may be in a similar dilemma?
That's a very good question, Dila. We are observing the situation in Ghana as in other countries very closely. And that's what I said, that the balance between saving lives and the livelihoods is a delicate balance. But that we have to also know that we cannot continue to lock down our economies forever, but we should really take the opportunity that countries are under lockdown to intensify public health measures, which we have outlined, which is all guided by the PACT strategy we are putting out there. So the government of Ghana has to intensify the ability to test people, detect the cases, isolate them. That's the only way you win this virus. We don't have a vaccine for the virus. We don't have treatment against the virus. So public health measures, intensifying public health measures is the key to unlocking. And you unlock in a stepwise manner and monitor the situation. And if certain communities are more affected, you re-implement certain measures that will help to contain them. I think that's what our guidance will be suggesting to member states.
Let me come back to Maren Sabo from Norway. 2 questions. How can the outbreak of COVID-19 affect people struggling with diseases such as HIV and tuberculosis? This is 1. And 2, given its history with recent outbreaks, are there any lessons here that Africa can provide for the rest of the world?
It's clear that we are all very concerned as a continent that COVID is coming at a time that we are still challenged with HIV. We're still challenged with TB and malaria and other diseases. So I think this is all but going to make it more challenging for us to fight other diseases that have been on the continent because of the limited resources and fragile systems that the countries in Africa have. So, and that's what we're saying. We will be advocating for these programs to be protected as much as possible and working with UNAIDS and other organizations to make sure that these programs remain on the radar of many African governments. with COVID and HIV, because of the limited data that we have on the continent as of now, with respect to the 2,000 people that have died, we need to analyze the data and understand who was infected with TB, who was infected with HIV and malaria, and what the underlying cause of the death was. So I think that is an analysis that, through the joint coordinated strategy and platform, we will generate a little bit more data. The second question was about...
Are there any lessons?
Oh, the lessons, yeah, Len. There are a couple of lessons that not necessarily for COVID, but for general response to disease outbreak that the continent of Africa can offer. One is the community response and strategy. Countries like South Africa are doing exceptionally well in fighting the COVID-19 because they are using the extensive experience that they had and had acquired from HIV programs to mobilize the community and make this and orientate the response towards a community ownership, leadership, and response. I think that is very important. Second is that you see countries like Liberia, Sierra Leone, and others using the experience that they had in contact tracing, using foot soldiers during the Ebola outbreak to actually deploy or redeploy that same strategy to supporting their response strategy. So in the whole PAC concept, the partnership to accelerate COVID testing, we believe that countries like Sierra Leone, Liberia, Guinea will actually use that expertise that they acquired a few years ago to bring that to bear. And these are not things that you easily see across many countries outside. The third thing is the strong political leadership. The political leadership at the level of the African Union Commission and the AU under the leadership of Chairperson Moussa Faki and the President of the African Union, President Ramaphosa, has been extraordinary. The fact that the head of states have met in sessions to discuss this extensively for the last couple of weeks, almost on a weekly basis, speaks to the strong political ownership, leadership, and will that the continent is paying to this crisis. They are seeing this as a serious health crisis, a serious security crisis, and a serious economic crisis. So these are all lessons that other parts of the world can learn from Africa.
Thank you, John. I just want to acknowledge two questions, but you've already answered them. The one is from Pamela from Channel Africa. Thank you, Pamela, for writing in. And she was asking about the Madagascar herbal remedy. And also Mara had another question on malaria and other diseases. But those questions have been taken already. Let's go out with a question from Getachew Tedler, Haley Georgios, and he's with the Deutsche Welle. And he says, the Africa CDC and Africa 50, what is the difference? And how do they cooperate to harmonize their mission? And he also wants to know about the actual situation on the continent, but I think you've given that already. But the next question is how to get out of this vicious circle.
Let me start with the last question. How to get out of the vicious circle is exactly what we are proposing. The gateway to ending this severe pandemic on the continent is through the PAC strategy. We have to go back to basics and apply basic public health measures in the absence of a vaccine, in the absence of treatment, which says we have to track people, test them, trace them, and treat them. If we do this consistently and apply ourselves to it with the resources there, it will be tedious work, but it is the formula for us to win. We're calling on Africa as a continent to deploy over 1 million community workers, and the head of states and governments have already issued a decision about 2 years ago that talked about deploying more than 2 million healthcare workers. I think we should tap on that, use that decision and move quickly and support the PAC strategy that we all, that the African Union, with the endorsement of the Bureau of Head of States, is putting forward. It captures everything. The second thing is the Africa CDC, the difference between Africa CDC and Africa 50. The Africa CDC is the specialized technical institution of the African Union. which was launched in 2017. It's also good to know that the Africa 50 is actually has made some resources available to support the Africa CDC's efforts to fight COVID. So I think the two are working in a very, very complementary fashion. And we, as a continent, I think the vision and the wisdom of the head of states to have established this specialized technical agency in an accelerated manner in 2017 speaks to the impact or the return on the investment that they are seeing now based on that concept, which is part of implementing the Agenda 2063, which I don't think people give enough credit to it the way it should be. I think they committed to establishing the Continental Free Trade Agreement is done. They committed to establishing an Africa CDC is done. They committed to establishing the African Medicine Agency is in the course of being done. I mean, countries have signed up to it, and it just needs to be rectified. So I think I say this to make a difference with the question the journalist asked about the Africa CDC. It's a young organization, but born out of the wisdom and the vision of our head of states.
Thank you very much, John. We've run out of time. Our 45 minutes is up, but this has been a very, very important press conference. We've had a lot of questions, and we want to thank our colleagues in the media for continuing to cooperate with us and for taking messages on COVID-19 out to our most important constituents, who are the African people. Let me also thank all of you who've been watching us on Blue Jeans and those who've been watching us on live stream. A special thank you to the South African Broadcasting Corporation for taking this press conference live. Join us again next week at the same time.
Thank you. Thank you all, and see you next week.
The African people. Let me also thank all of you who've been watching us on Blue Jeans and those who've been watching us on live stream. A special thank you to the South African Broadcasting Corporation for taking this press conference live. Join us again next week at the same time.
Thank you. Thank you all, and see you next week.